osteoporosis, basically one of the things that you're going to see, peak bone mass basically occurs at about ages 25 to 30. Okay? And then what happens is that osteoclastic activity will outstrip the osteoblastic activity. What you're going to see is that bone loss will increase after menopause in women because of that estrogen loss. It also will decrease because of low testosterone in men. And if you look at these commercials, you think everybody has low testosterone because that's what they're pushing right now. And that's often not the case. It slows at about age 60, but it doesn't stop. It continues throughout the lifespan. Typically what you'll see is that women have lost between 35 and 50% of their bone mass, and men lose about 20 to 35% of their bone mass at the time of death. What happens is that sometimes that outer cortex, which is the supporting structure of the bone, thins to the point where fracture is fairly common. Now, what you will see with osteoporosis is a chronic progressive metabolic disease. It's characterized by porous bone, low bone mass, and structural deterioration of the bone tissue. In other words, what happens is that outer cortex of that bone thins, the spongy in the middle also breaks down and thins, so you have a dramatically weakened bone. Typically what you will see is that osteoporosis is the disease. Osteopenia, okay, P-E-N-I-A, basically means bone loss to the point prior to osteoporosis, okay? So what you will see is that you get normal bone, osteopenia, osteoporosis. So what we want to do is to prevent osteoporosis if they get to that osteopenic stage. The best way to treat bone loss as we age is to build it up as much as we possibly can while we're young, before the age of 30. And so what we as nurses need to do is to be teaching our adolescents, our teenagers, calcium, 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 exercise, build that bone mass, okay? Because sedentary activities like playing video games or being on the computer does not contribute to that bone buildup, even if you take the calcium and vitamin D, okay? So prevention is the best treatment. And the earlier that you can do that, the better off you're going to be. Just a FYI, approximately 8 million women, 2 million men have osteoporosis. About 34 million have osteopenia. Now typically what we see, you can come to your seat. It's okay, you can go to your seat. Since 85 is a parking lot. Kyphotic spine, okay, you see that little hump at the back? That is one of the signs that you will see of osteoporosis, okay? You may hear it referred to as a dowager's hump, okay? Or like a little buffalo hump. But it's not really, it's the normal curvature of that spine. It's not like that fat that you see on the buffalo or that you see with your patients with steroid use. This little hump is due because of that curvature of the spine. what you find is that bone is that constantly form and absorb. You will see that loss of that cortical bone earlier. It thins and it will progress faster in women than it does in men. And most of that is because of estrogen loss. Common sites of fractures due to osteoporosis are the wrist, the vertebra, and the hip. Now, why the wrist? Falls. Because a lot of people will try to catch themselves whenever they fall. Okay? And the putting down those arms often is enough of an impact to cause a fracture. Vertebra, a lot of times what you will see is that those vertebral bodies, remember I showed you that yesterday, the bodies collapse on themselves. And it causes excruciating pain because what it does is entraps the spinal nerves and causes pain in those women. Now the hip, again, falls. Okay? So what you're going to see with these folks is that age-related osteoporosis will relate to some of these falls. Now, there can be a secondary osteoporosis or type of osteoporosis. And typically that's due to factors other than age. Hyperparathyroidism or long-term therapy with corticosteroids or heparin can do it. Okay? Think about your patients with COPD. What do they take on a daily basis to help manage their... They take prednisone. Okay? It's a steroid. So your patients with COPD or a disease condition like an autoimmune disease where they're taking steroids to dampen that immune response tend to have secondary osteoporosis. Okay? Now, there is a third type of osteoporosis, and that's regional. Any of you ever had a cast? Okay, what did your arm look like or leg look like when that cast came off other than hairy? It was very white and the muscle had deteriorated. Okay? Typically what you will see is when there is an external cast on a limb. That bone, even though it has healed, is still weakened. And it's just because it does not have the effect of gravity on it. So regional osteoporosis is typically due to a cast or some type of fixator or something that is decreasing the movement and the effects of gravities on that limb. Okay? So, what do we see? Risk factors, females basically are twice as likely as men to develop osteoporosis. Typically what you will see this is after the age of menopause. Usually what you will see is women in their 50s or early 60s start having those symptoms. Now, men also develop osteoporosis, but typically you don't see that until about age 67 to 70. Much, much later. Okay? Family history. If your grandma had it, your mama had it, you're likely to have it. Okay? Now, what does that mean? I'm doomed? Yes. No. What it means is that you better institute some lifestyle changes and increase your calcium and bulk up your bone as much as possible in order to prevent the complications. Yes, you might develop osteopenia or mild osteoporosis, but if you implement those changes, then you can help decrease some of the effects that disease process is going to have. white or Caucasian or Asian ethnicity are more likely, okay? It does not occur in the African American population that often, though it can, but it's usually at a later age. Small stature. This is one thing I'm glad that as my doctor says, I'm a woman of size. Okay, in other words, instead of calling me fat, he just says you're a woman of size. So, little skinny women are more likely to develop osteoporosis than people that have slight obesity or some morbid obesity. Because think about it, this takes a lot of gravity to move around, okay? Typically what you see with your folks of size is that they're more likely to have arthritis than they have osteoporosis. Doesn't mean that they can't get it, but they're more likely not to. People with thin frames tend to develop osteoporosis more. Now, excess alcohol intake and smoking. These are two lifestyle changes that can be. Now, what is excess? Well, according to the American Heart Association, it's more than 1 drink per day for women. 8 ounces of beer, 4 ounces of wine, 1 ounce of liquor. Yes. New guidelines. Men, it's 2 drinks.
Can you save up all week?
You cannot save up all week. That will give you a fib. That will give you a fib. Men, it's 2. Women, they've gone down to 1. Okay. Now, is that really excess? Probably not. I mean, someone that has 2 drinks a day, because I'm going to tell you, if somebody pours you 4 ounces of wine in that big glass at a restaurant, you're going to be PO'd because it's $10 a glass. Usually what you get is 6 to 7 ounces in those glasses, okay, which would be up to 2 drinks. But occasional alcohol is not a problem, but if you have an excessive alcohol intake, it does decrease the strength of those bones. Okay? High caffeine intake, whether it be coffee, whether it be Red Bull, whether it be soft drinks, tea, whatever, okay, can also decrease bones. And of course, if you're using soda, the phosphorus in the soda, in addition to the caffeine, is going to be what's going to be one of the problems. Now, these female gender, family history, white or Asian, are things you cannot change. Okay? This often is something you cannot change, or you really don't want to change. These you can change. Some other modifiable risk factors. Menopause. Well, it used to be that everyone that went through menopause, you automatically got hormone replacement therapy. Everyone was on Premarin. Do you know what Premarin is made from? Mare's urine. Okay? Pre-mare-in. Like, they didn't want to say horse pee because nobody would take it, but that's basically what it's created from. Okay? Basically what they found is that, yeah, it probably decreased some bone loss, but what other problems does hormone replacement therapy give? Breast cancer. What other kinds of cancer? ovarian and cervical, any type of cancer with the reproductive gland. Okay? Now, that's not to say that hormone replacement therapy is not appropriate for women that have to undergo oophorectomy in their 20s, 30s, or 40s. Okay? But it's one of those things that hormone replacement therapy is not recommended for the prevention of bone loss. It's not recommended as a routine. It's only recommended with someone with extreme symptoms. Now, calcium deficiency is also a modifiable risk factor. What you see is that when dietary calcium is insufficient, the body takes the calcium from the skeleton, which basically weakens those bones. Basically, whenever it's removed for bones, it's used so that the kidneys can buffer excess acid. And what happens is that if you have that acidosis that's present, osteoclastic activity, which breaks down bones, basically kicks into gear. Okay? So if you have a patient in an acidotic state, then they're going to suffer more bone loss. Smoking, nicotine, alcohol, both of them decrease blood supply to the bone. Okay? So that if you have blood supply to the bone that's disrupted, and a lot of bones don't, it depends on where the bone is, a lot of them don't have a lot of blood supply. So that's what makes treating bone infections so difficult, is because they have minimal blood supply to some areas. Weight-bearing exercise is probably the best thing that you can use for prevention. That sedentary lifestyle, video games, TV, quietly reading, basically increases bone loss. But weight-bearing exercise, and probably the best one is going to be walking. Now, if I have got a little lady that's osteoporotic, meaning she's always gotten weakened bones, I do not want her doing high-impact aerobics, okay, or even low-impact aerobics, because they may suffer bone fractures during that exercise. Usually what you will see is that yoga, tai chi, those types of things with very minimal impact are very good. Walking is very good. Now, let's think about swimming. It's good exercise, but it's not weight bearing. Okay? So, bicycling, again, some weight bearing, but not as much as you need. It's the weight bearing exercise that makes the difference. Your medications, aluminum containing antacids, anticonvulsants, glucocorticoids, prolonged hairpin therapy, antiretroviral therapy can all increase the risk for osteoporosis.
The top.
It's on the very bottom of the slide. Basically, what you're going to see, if your patient is on those medications, then you need to make sure that they're supplemented with calcium and vitamin D, and that they get adequate calcium intake. It's better to get it from diet, but if you can't get it from diet, then supplements are the better way. Now, how can you tell if a calcium supplement is being absorbed, or if you're just taking it and wasting your money?
In and out. Urine.
Nope. Easiest way is just to take it, the tablet, put it in some like cider vinegar, which is an acid, that's much weaker than hydrochloric acid. And if the tablet dissolves in less than 20 minutes, then you're good to go. The other thing is that if you look at the stool, if you see undissolved tablets come out, that's not a good thing.
What about those chew things?
The chewables are very good, okay? And a lot of times what you'll see now, the Tums, they sometimes will have people to use those as their calcium because they're calcium carbonate, and they not only do the antacid, but they're good for the prevention of osteoporosis. Now, male risk factors are a little different. Again, greater than 70, body mass index less than 20 to 25. Okay? So here we're not talking about a skinny little beanpole. We're talking a male of sort of average BMI. Okay? But what you really see is that they are on the normal to thin side. But what you will see is that weight loss of greater than 10% in the males will increase the risk of osteoporosis. And that's also a risk factor for females, especially for these women that do bariatric surgery or men that do bariatric surgery and lose a lot of weight rapidly. Okay, osteoporosis can occur. Physical inactivity, previous osteoporotic fractures, low calcium diet, androgen deprivation therapy. What men are on androgen deprivation therapy?
Roid rage.
Prostate cancer.
Yes, men with prostate cancer. My patients with spinal cord injury. Okay, again, because they don't have that pull of gravity. They may either be wheelchair bound or not very active. They have that loss of bone because of that inactivity. Now, I will also tell you that inactivity also will put them at risk for kidney stones because of the leaching of the calcium. The most common fracture that you see in men is going to be hip fracture. And I will tell you, for men, the 1-year mortality after hip fracture is twice that what it is for women. Hip fracture in an elderly patient is not a good sign because 30 to 40% of them die within the first year after that fracture. Secondary osteoporosis, we've talked about a little bit. Other causes that you will see, oophorectomy. Remember, hysterectomy is taking out the uterus. Oophorectomy is taking out the ovaries. Anorexia. When we talk about some of the eating disorders, anorexia nervosa, where basically these women starve themselves to death because of body image issues. It's a cause of secondary osteoporosis because of decreased calcium intake. Now, often what you'll see is they get all the exercise they can do, because if a calorie goes in, they exercise until 3 calories go out. But it can cause a secondary osteoporosis, liver disease, and diabetes. Like I told you, if diabetes is an answer, pick it. 9 times out of 10, you'll be right. Corticosteroids, anticonvulsants, alcohol, immunosuppressants. And look at this, loop diuretics. Because you excrete more calcium with those. Okay, furosemide or Lasix. It's one of the major drug drugs used for treatment for heart failure or patients with congestive failure. May also be used for blood pressure control. Hydrochlorothiazide is also a loop diuretic. Clinically, what you see is a silent disease. You don't know you have it basically until you get a fracture, typically. However, now they're starting to screen for it more and more. Basically, what you often see is a sudden strain or a fracture, back pain, loss of height, and spinal deformities. The spinal deformity is that kyphosis that you see. The loss of height, typically what you're going to see is that you lose that 1 to 2 centimeters. It may be accelerated from that, and that's because of the collapsing of those vertebrae and the kyphosis. Typically what you're going to see is that fractures of the vertebral body are most likely to occur at T8 to L3. Okay, so you're going to have back pain in the lower back region. Now, of these patients that do get this fracture, what you're going to see is that 20% of them are going to require long-term care. They're not going to be able to go back to their previous living situation. 40% will regain their function pre-fracture. But the other 40% may have deficits related to that fracture. Now with this loss of height, you see that progressive, or this is the normal spine, you see it's a progressive as this person ages. So that now you've got some safety issues because they can't look. And they may have difficulty turning their head if they're still driving. Now, one of the things that you may also see is that not only do the bones in the body weaken, but you may have some problems with the jaw. And often what you will hear is the patient will complain, my dentures don't fit anymore. And that's because of the loss of bone in the jaw, under the gum, and their dentures do not fit because of bone removal. Typically what you will see for diagnostic tests, history of physical. Did your mom have osteoporosis? Well, she was a little stooped whenever she died. Because, you know, sometimes what you will see is that the big push on osteoporosis has been within the last 20 years. They may do an ultrasound, and they do a bone measure of the heel. It's not as accurate as this dual energy X-ray absorptiometry. DEXA is what everyone calls it. Typically what you will see with a DEXA is there's no procedure care. They're just told not to take their calcium supplements on the day of the scan. The other thing is they need to wear pants that don't have a zipper or a button, metal button. Otherwise they have to change into gym shorts. Because the metal in the zipper or the button, like on jeans, will cause some feedback. Medicare will pay for DEXA scanning. Most insurances will. Typically, it's recommended that you have a baseline scan at the age of 50, and then start having scans maybe every 5 years, I think at age 65 and older. Baseline at 50. Because what they're trying to do is get them either at the time of menopause or premenopausal. Okay? So what you want is that baseline scan to see what the bone is, and then check for bone loss thereafter. Now, Medicare will pay for DEXA scanning every 2 years in people that are 65 or older that are either estrogen deficient, and I'm hoping at 65 they've gone through menopause, they have vertebral anomalies, or they have long-term steroid therapy like your patients with COPD, or they have primary hyperparathyroidism. Okay? DEXA looks like this. Basically what they do is they look at the thickness of the bone at the hip and at the vertebral column. Okay? If you've had hip replacements, hips don't work. So they look at like the heel and the vertebral column. 68-year-old woman, here you can see a normal bone density, okay? And what they come up with is this T-score. So they look at what the T-score is, normal osteopenia or osteoporosis. And you can see that her T-score was in this normal range. Now, at 74, this woman, basically what you found was that her T-score was in the osteoporosis range. Okay? So you can see how dense these bones look here in that hip and here. Okay, now look. They're not as dense, and you can see that there's some cortical bone loss there. So this one is osteoporosis. Now, if you look, I gave you the list. Normal is -1 and above. Osteopenia is -1 and -2.5. Osteoporosis is -2.5. Don't worry about knowing specifically those levels. Just know the lower the T-score, the more likely they are to have osteoporosis. Now, one of the things that Kaiser Permanente did in California is that they identified all of the people that were being covered by their insurance. And what they did is they screened them. And they came out with a number of people that were at risk or currently had osteoporosis. And so what they did is they instituted measures to help prevent further injury and or bone loss. And it's estimated that they saved $30 million by just doing this screening. That's one of the reasons, that study was one of the reasons why Medicare now pays for DEXA scan. This is just an example of what vertebral column looks like. You can see the bodies here are fairly dense. This is a normal scan. Okay, and you can see that they look fairly sort of square. But look at the difference. See the lines here? Okay? That means that they're level. But look at the lines here. That means that there's been an area of collapse. So what you can see is you hardly see outer cortical bone here on this person. And then, of course, this is osteoporosis. Think about this vertebral column collapse, okay? what you got is you've got that vertebral column, one vertebra sits on top of the other. And what happens is that the spinal nerves exit out the little holes between them. Well, when that vertebral body collapses, it impinges on that spinal nerve, and that's why these people get back pain or leg pain. It's because those nerves are pinched, and it can cause severe damage. Okay? If the vertebral collapse is enough that it impinges on the spinal cord, it can cause paralysis. So it can be really a big deal with vertebral injury. Now, our collaborative